Hey, welcome back. This is Dr. Tyler Williams, Better Sleep SLC. Excited to be sharing this video with you. Today we're covering a topic that's one of the most asked questions we see, and that is, what are my sleep apnea options without CPAP? Now, first of all, a little bit of history on CPAP. CPAP stands for continuous positive airway pressure. So maybe you've had a CPAP, or maybe you've heard about them. Maybe your bed partner or spouse has a CPAP and you don't like the idea. With a CPAP, what it does is that when you wear that mask and it seals on your face, it continuously puts air pressure in, which overcomes blockages or problems that you're having that cause you to stop breathing during sleep. So with sleep apnea, you kind of have three types. You have snoring, which is not actually sleep apnea, but often it's incorporated with sleep apnea, or a lot of people who snore will later develop sleep apnea. Snoring alone isn't always a medical issue, but it's often a nuisance, and so maybe your bed partner's elbowing you or sleeping in the other room, or your kids or family are barking at you because they can't sleep well, because it sounds like there's a bear in the cave, so to speak. And so snoring is problematic, but it's because the muscles in your throat and airway in the back, they relax over time. With age, they lose their elasticity, and as they droop down, when you breathe in and out during sleep, it makes that noise that most of us don't like to be around. Now with sleep apnea, sometimes there's audible snoring, sometimes there's not. Sometimes we refer to it as silent snores. Within sleep apnea, there's two types of sleep apnea. There's obstructive, which is the most common. That's where when you lie down, your tongue blocks your airway. Whether you're a nose breather or a mouth breather, when your tongue blocks your airway, the problem is air can't get up and down from your throat to your lungs because both the nose and the mouth portals or gateways to your body to breathe in are closed off by your tongue. If you're a male, you're over 65, history of high blood pressure, and your shirt size is a 16.5 inch or larger, 16.5 inch neck size or larger, there's a 95% chance, unfortunately, that you have sleep apnea. However, we also see a lot of younger patients, we see a lot of healthy patients, we see a lot of fit patients, sometimes muscular patients, a lot of muscles in the neck, and those muscles, they encroach on the space in our airway and they can push our tongue in and also cause sleep apnea. Often we see people who have very small frames, especially petite females. They just have a very small airway, and it only takes a little bit of movement from the tongue to block that airway and causes sleep apnea. So we see this a lot with females who just say they don't sleep well, or they have headaches, or they doze off during the day, or their sleep habits are irregular. And if this is you, you may have sleep apnea, or maybe you've already been diagnosed and your doctor told you should wear CPAP and you're looking for something different. Central sleep apnea is more neurological. It's more in the brain and the body, and that's where your neurological system is, for some reason, shutting off multiple times during the night, which causes you to gasp or stop breathing. So a lot of people have mixed apneas where they have both. Regardless of the reason, if you can wear a CPAP, if you're tolerating it, if it's comfortable, if you wear it nightly, generally we encourage you to keep doing that. We know it's not the easiest thing to deal with. It's kind of a pain to get through the airport security. You have to take it out, check it in separately. But CPAP does work well. It's often a frontline option. And if your physician says, hey, you should wear the CPAP, we suggest you do that first. However, if you're looking for an alternative, maybe when you travel or go camping, or you have a trailer and hauling your CPAP's not practical, we can offer some alternative options. Besides the CPAP, generally you have surgery, diet and exercise, or an oral appliance. Sometimes you do multiple of those things. The surgery can involve things on your throat and airway, can also involve an implant that you have that essentially shocks your tongue and tells it to move forward so that you keep breathing. It is expensive. It's not covered by insurance. It can be a little bit invasive, but it works well in a lot of cases. It doesn't work for every type of airway, but it's a good option. Diet and exercise are always great. We recommend 3 to 4 times a week. Work with your physician and possibly a personal trainer. even if it's walking, riding a bike, going to the gym. We recommend you don't eat after 8 p.m. whenever possible. Avoid caffeine and alcohol, especially after 3 or 4 in the afternoon, because the stimulants or the sedatives can cause problems with sleep, smoking as well. But sleep apnea is a really good way, or it's really easy to treat it as long as you're doing those things you're supposed to do. So with the oral appliance, it's a great option for those who say, hey, I don't want surgery, I don't want a CPAP, I don't want to wear this big mask with a hose, and they work really, really well. They don't always work the first time you wear them. What I mean is they're comfortable for most people, but sometimes we have to do a few adjustments, send you home with an updated test to make sure that the tracking is accurate on them. But people comply with them very well. Unfortunately, about 2/3 of people quit or fail CPAP. So even if you were recommended CPAP and your physician said, hey, you need to wear a CPAP, if you can't wear it or you're not getting any results, the oral appliance is the FDA cleared alternative. Now be careful of ads on TV or appliances that you buy over the counter. They're not approved for sleep apnea. They're approved for snoring. The reason is sleep apnea is a medical condition, and that has to be diagnosed and treated under the care of a physician and other healthcare providers that can work with you. So at Better Sleep SLC, our niche is patients who can't wear a CPAP, won't wear a CPAP, or they have the type of sleep apnea that maybe they're a better candidate for a different option. And the oral appliances work really well. We've helped many, many patients sleep better. We love getting the feedback when people say, thank you so much, this is incredible, or I'm so glad I could use an appliance. My husband wore a CPAP, he hated it, I hated it, and we're getting those results. And most importantly, follow-up management, monitoring. We always work with your physician. We handle the dental side of it, which includes making the appliance, the follow-up, making sure your bite looks good, making sure you're a good candidate, coordinating with the labs, and then also helping sure that you have follow-up treatment and guidance on using the appliance. There are no set it and forget it appliances, because over time your body's going to change, your medications are going to change, your sleeping habits are going to change, the fit's going to change. Maybe your dental work changes, maybe you get an implant or some new caps or veneers on your teeth, or you lose a tooth, and that can affect the fit of the appliance. So that's an important part of it, that all that's done correctly. If it's done incorrectly, or you use a stock or over-the-counter appliance, unfortunately that can cause bite shifting, and we have seen problems with teeth getting crooked or even sleep conditions worsening from an appliance that was not made in a lab. There's a lot of dental offices that can make a mouth guard, but you really want to work with someone who understands the medical model. Oral appliances are not covered by dental insurance. It's not a dental treatment, it's a medical treatment. So if you have flex spending, health savings account, medical insurance, or Medicare, often they are covered to some degree, not always entirely, but some degree, and they cost a lot less than CPAP, which people like to. But you need to work with a dental provider who understands how to work with your medical provider and do the medical billing, and that's where we really come into play. So we look forward to seeing you on the next video. Hope this helps answer your questions about some alternatives to CPAP, and thanks for watching.